The National Coalition for Cancer Survivorship advocates for quality cancer care for everyone touched by cancer. Founded by and for cancer survivors, NCCS defines someone as a cancer survivor from the time of diagnosis and represents the millions of Americans who share a common experience, living with, through, and beyond a cancer diagnosis. In Cancer Convos, NCCS talks with survivors, advocates, caregivers, providers, and health policy experts about survivorship, advocacy, and public policy. For more information about NCCS, visit our website at canceradvocacy.org.
Welcome to Cancer Convos. I'm Lindsay Houff. I'm the Senior Policy Manager at the National Coalition for Cancer Survivorship, and this is my first podcast ever. I am a total podcast junkie, and this is the first time being on this side of things, so I am really thrilled that it's on a topic that I care so deeply about, and that is healthcare policy. At NCCS, I work on legislative priorities, and I also now oversee our grassroots advocacy group, and we call that the CPAT program. And so today I am thrilled to be interviewing one of our star advocates who is on our steering committee for the CPAT group, Jamie Ledezma. And Jamie is a cancer rights attorney, and she's a cancer survivor herself, actually. Her bio, I was just looking at it again yesterday, is so incredibly impressive. But I have to say that, Jamie, I follow you on Twitter, and I just think your Twitter bio is way more fun. So I'm going to read your Twitter bio if that's okay. And people can look up your amazing credentials later. So your Twitter bio says that you're a criminal justice professor, former prosecutor, cancer rights attorney, policy optimist, I'm right there with you, Hamilton obsessed, and the coolest gig of all, mom. So Jamie, thank you so much for joining us today, especially given these crazy circumstances, for a conversation about health policy in the time of COVID-19. So Jamie, how are you holding up through all of this? How's it going?
Well, first, thanks for having me on with you today, because I am, like you, a fellow podcast junkie, and this is my first rodeo, I have to say, on this side of the show. So I'm really excited to chat with you. And as where we are today, the end of April, I cannot believe that it's going to be May this week, and living in an environment where we're all working, for most of us, we're spending our days at home, right? I have my husband who's in the other room doing a conference call right now. I'm here with you, and my son's in the back of the house doing his Zoom with his classroom, right? This is wild. We're fortunate that we are faring very well given the circumstances. And my family has been able to adjust and adapt with the current stay-at-home orders that are in place where I'm at, which is in San Diego in California. So we have both state and local orders in place. And again, my family's been able to make that adjustment rather smoothly. It was a bit of a learning curve the first 2 weeks, but I think we're going on week 5 or week 6. And so we're becoming pretty well versed at how to find our certain corners in the house. But, I have to say, Lindsay, my husband and I keep, and a lot of my colleagues and friends, this really brings to light a chance to reflect on, I think, what's close to my heart and near and dear has been really facing and understanding some of the barriers and inequities in access to healthcare. And this scenario of where we are today in COVID-19 has seemed to really shine a light on what is in ordinary circumstances when somebody's facing serious life-threatening condition like cancer, and then you throw that on top of it, a pandemic. So it's wild, but we're doing okay. But, it's hard for all of us to wrap our mind around it. That's for sure.
Yeah, absolutely. And I know that you yourself, you're a cancer survivor. So you get, I think, what a lot of cancer survivors are going through right now and thinking during these really uncertain times. And I think back to the first time that we met, and actually we were headed to the Capitol for a press conference with Speaker Pelosi, and you shared your story at that presser, and I was just blown away. I was a new mom myself, and it was such an amazing and incredible story. Would you share how you got into cancer policy and what your cancer background is?
Of course. So I love policy, and as somebody who follows policy from really recreational and amateur point of view in that I'm interested in understanding the different laws and the different policies that are proposed and those that get passed and how they're implemented and what they look like. And so I've studied political science in undergrad. I ended up going to law school, and I was really interested in how that process worked, but I never had a cause or an issue that was near or dear to my heart. And then early in my career, after a few years of practicing law, I was working as a young prosecutor with my husband, who is a high school teacher, and we were really just about to start our family, really excited about what the future held for us. We kind of had this, sketched out life plan of what we thought it would look like. Meaning in my head, I'm at this time a prosecutor, and I am proudly wear the rule follower sticker on my shirt because, I'm that person who, really doesn't jaywalk. Would never fare well in New York. I envy that aspect of risk taking, right? So I am doing everything right, checking the boxes in terms of making sure I'm following all the steps. We were able to get our first little starter home. We had a little dog. And then right as my first trimester was ending with our first and only pregnancy, I had felt a lump in my breast. I had a really strong family history of breast cancer in my family, and I was well aware of that. And fortunately, again, I also had great access to healthcare all through my childhood. Both of my parents were government employees, blue collar government employees, and that they never had the opportunity to go to college, but we had great benefits. And then once I got into the workforce, I also worked for the county, and my husband was a school teacher. So we had great healthcare. In fact, at the time, I'm 27 years old. I have double coverage of private health insurance. So I had double PPO coverage, and I'm a young prosecutor. And I was really excited about our first child and our pregnancy going well so far. And I'm at the end of my first trimester. And so my nerves about a potential miscarriage had really kind of subsided when I filled this lump. And I found it alarming because of my family history. But all through my adolescence and young adulthood, I had raised my family history to my providers, my own general practitioners or my family care doctor, and each and every turn, my providers would reassure me that I had nothing to worry about because the family history that presented in my case was always on my father's side. I lost my paternal grandmother to breast cancer at the age of 54. I lost my paternal aunt to ovarian cancer at the age of 44. And my paternal first cousin was diagnosed with breast cancer at the age of 34. And so I continued to tell my providers this information, and they said, nope, that's just a coincidence. And so when I felt this lump, I was alarmed, but logic stepped in, and I had become, up to that point, as informed as possible. I read the literature, I talked to all of my doctors, and I was told I had nothing to worry about. I'm 27 years old. I'm pretty active. I had just finished a full marathon less than 3 months before, and I never smoked, never drank, remember, rule follower. So I thought this must be a pregnancy symptom. It's my first pregnancy. So I pulled open the book of what to expect when you're expecting, and I looked in the table of contents, and there wasn't anything about when your milk duct starts to, I thought this might be a clogged milk duct. And so I looked that up in the tables of contents. I look it up in the index. There's nothing. And so I kind of slammed down the book in frustration. And I tell my husband, I said, you know what? We need to go to the doctors. And when I get this all figured out, I'm going to write a letter to the editor of what to expect when you're expecting, right? This is the cornerstone of what every new mom gets early in her pregnancy. And I'm going to insist that they include a section on that. Because people like me, I'm hungry for information. I'm always looking for facts, and I'm trying to become well-informed. I need to know this information. Turns out my doctors were able to get me in right away, took my case very serious. And when I raised the issue of feeling a lump in my breast, and within 48 hours, I learned that I had stage 2B, invasive ductal carcinoma. I had a 3-centimeter palpable lump in my breast, and my diagnosis, my pathology was that the breast cancer was triple negative breast cancer. And within a matter of a few months, I also learned that I was BRCA positive. And so what all that means, for those who are not familiar with breast cancer, and specifically is that I had a rather aggressive type of breast cancer, which has a higher mortality rate. It's more commonly diagnosed in women of color and younger women. Because it's rarer than the other types of breast cancers from a pathology standpoint, there is not a targeted therapy. And so there posed a number of different concerns with that. But the biggest concern with my diagnosis was that I was told I had breast cancer on Valentine's Day, and I was 13 weeks pregnant with my son. And so in that moment, our life just kind of really froze.
Yeah. Oh my gosh, I can only imagine. And you talked a little bit early on about how, your access to healthcare and healthcare literacy, really was a change for you. And not everyone is so lucky. And I think that we're obviously seeing that play out now through this pandemic. And, people living with cancer, it can be really, really hard to keep up with everything that's constantly changing at state and federal levels. And this has shown a light on a lot of inequities in our system. I know that we were talking recently about NCCS is getting a ton of calls and emails from patients across the country who are really, really worried about their access to health coverage. They're worried about their jobs. They're worried about their finances. I just recently got an email from a cancer survivor who he works at a grocery store. And like so many other people, he gets his insurance through his employer. And so, of course, he's worried that he's putting himself at risk by working because, he has cancer and his immune system is not as strong as it would be. But he also needs to work in order to maintain his health insurance. So we get those emails and he's saying, what do I do? Or what's out there for me? So as a survivor yourself, from that perspective, can you talk about what it's like right now for patients just trying to navigate this like really complicated system in this uncertain time?
Yeah, I think what you point out is exactly correct for the most versed experts in the field. So people who are writing the laws and who are implementing these policies are confused with the speed at which things are changing. And so what we are really seeing, from a health standpoint, the pandemic of what we are all seeing unfold around the world right now of coronavirus from a scientific standpoint and a health standpoint, that this is something unprecedented. We've never seen it before. But you put that aside and you just look at the implementation of the policies that are being adopted right now. From a policy perspective, I don't think any of us have ever seen legislation unfold as quickly as it has at the federal level and even at the state level. And so that is something that, again, the folks who are working on the Hill, buckle up because this is fast and furious. So for the cancer patient, or somebody who is either, in active treatment or post-treatment and has concerns about whether it's concerns, how do they get into their doctor? How do they access health insurance? How do they keep their health insurance? What about work? Maybe immunosuppressed and I want to take appropriate safety measures. I can do my job, but I rely on public transportation to get to and from. And I know that that the subway isn't as the safest place for me right now. All of those issues are tangible concerns that really impact our lifeline of living with and after with cancer, and that's access to care. And to be able to ensure, and I know that you and I also spoke about somebody who reached out to NCCS about, it's one thing to have access to care, but I need my care. I have a relationship with my oncologist that the idea of losing that provider and going to a new plan or a new system in a period like this when there's so much uncertainty and confusion and really a mass exodus of what we had 22 million people in the last few weeks, in the last 2 weeks file for unemployment. So we don't want to have to find ourselves navigating the system with everyone else. We have an existing relationship. So this is a profound experience in general for people in the cancer community. There's a lot of issues that we have to navigate on a good day, and then you throw this in and it is compounded. I'll say though, Lindsay, I'm that internal optimist, and I have to say there's silver lining. I am that person, right? I am that person that I'm going to find the silver lining in it. And so, as alarming as this can be, and for myself as well, right, especially when this first started occurring, as alarming as this can be for the individual who lives with cancer and their families, we're prepared for this in a certain respect, right? We're the expert in living with life threatening conditions and how to navigate your provider or how to get that person on the other end when you call for Social Security, how to actually talk to a person, right? Because we spend, before coronavirus, talk to any cancer patient and they're going to tell you it's nearly a part-time job, if not a full-time job, to keep up with your medical bills, calling providers, reading explanation of benefits, talking to your HR office, right? So that is what every cancer patient has experienced. We've already walked this walk. So in many respects, this might be, as much as we don't want it to be, this might be a chance and a place for us to step up. And it might be with your cousin, it might be with your parents or a sibling, or it might be in your own community, whether that's a neighbor or a coworker, because folks, we're not the only ones impacted, right? This is us and 6 billion people, but it is different. There are different issues that come up, but I think that, our cancer experience in a way, while it puts us at greater risk and brings up a lot of concerns and fears for all of us, it also might give us a chance to take a moment and tap into some of the strengths that we've developed through our own experiences.
Right. I like that, seeing the silver lining through all of this and how cancer survivors are kind of uniquely prepared for this kind of stress and uncertainty. And I also like what you said about, just everything is changing so quickly. And it's like, buckle up, buttercup, because it's still changing so quickly. And I can barely keep up with what day of the week it is, much less which congressional package has been voted on or passed at this point. But right now, it looks like there have been 4 legislative packages now related to COVID-19 relief, and they are continuing to work on more. The most recent package, I think, included $75 billion for hospitals and physicians, and then $25 billion for improving testing for COVID. And at NCCS, we're really urging Congress to expand paid family and medical leave to include cancer patients and those living with chronic illnesses, because right now they're not included in that group of folks. And like you said, many cancer patients can't work right now because of their diagnosis, and it's compromised their immune system, and they are at higher risk. And so we want to make sure that cancer patients are protected, and this policy change is needed for those cancer survivors, like the gentleman that I was talking about earlier, who, gets his insurance from his employer at the grocery store. And the bottom line, I think, is that no one should have to choose between their life and their livelihood. And we want to make sure that, through all of this, especially all the decisions being made for relief for people out there, we want to make sure that cancer survivors are part of that and that their voice is being heard. And I appreciate all the work that you do to make sure that cancer survivors are represented in those decisions. And we'll actually be posting information on how everybody out there can help. You can call your members of Congress. You can urge them to sign on to this effort. And of course, like always, reach out to NCCS. We're happy to help, connect you and make sure that you have all of the information that you need. And so, speaking of information, so several states now who operate their own Affordable Care Act exchanges, they're holding special open enrollment periods for those who might be uninsured, so that now there's a process through which they can get insurance right now. Can you shed some light on maybe that aspect of it and what other resources are out there for cancer survivors and patients who are kind of in a tough spot with their healthcare or might have questions about, their jobs or their rights in the workplace?
Yeah, there's a whole host of, again, this is in a good scenario, this is a complex web to navigate, but there's a ton of resources out there. So, first and foremost, none of us are expected to become the expert in it. But I think if there's one of the strengths that come out of your experience of living with cancer, it really needs to be to ask that question, right? Ask the question, raise issues. You may not always get the answer that you like, but what we're doing is, as much as you are trying to become better informed, we're informing those in positions of decision-making authority. And so ask the questions. I think your best resource right now for everyone who is living with cancer has to be your own care team, right? Because they are going to be the ones who are going to let you know what is available in your region. And so I really tapped into, and in fact, this morning I already spoke with my own care provider, and we have had several of telehealth sessions, right? So hopefully more and more cancer centers and oncology offices are getting patient navigators or financial advisors within their offices. These all can be great tools for you. There are a number of organizations in addition to, start with NCCS and their website, but some of my favorite go-tos for understanding what the current state of the law is wherever you may live would be Triage Cancer, the organization that I partner with. They are a volunteer nonprofit organization that provides information on laws at the state and federal level, because what the law is in California is not going to be what the law is in Florida. And these laws change on average every year. You're going to see legislative changes. And right now we're seeing legislative changes happening by the day. And so you want to make sure that you are getting the correct information. Another organization on financial resources for the cancer community is cancerfinances.org, which partners with Triage Cancer. And then there are cancer-specific resources. For breast cancer patients, the Pink Fund offers financial resources. Leukemia and Lymphoma Society has set up a COVID financial aid program, and the Lung Cancer Fund of America provides weekly updates on COVID-specific resources for the lung cancer community. I also, in terms of getting information and understanding how quickly this is changing, once those laws are getting passed at the federal and state level, they look to our agencies to implement those policies. So for me in California, I look at the Department of Healthcare Services. So go to your state agency website, whether that's for unemployment benefits or that's for health insurance information. They will also give you important information on changing deadlines related to any exchange plans, which we know is the health insurance marketplace. And again, not every state has opted into having their own marketplace. There are some states that use healthcare.gov, the federal marketplace plans, but the states that have their own plans, many of them have reopened enrollment, but for a specified period of time. And so, for instance, in California, I believe open enrollment continues, not exactly sure on the day, but it continues at least through the month of May. Some other states have already started to close. I think last week or this week, we may see some states close their special open enrollment period for the marketplace. But take a look at those states. This is an opportunity to access insurance. Some of the changes that we've seen, actually, I have to say, not only is legislation coming down so quickly, but in terms of equity and increasing access to care for the cancer community, I have to say these are big steps. I'm very happy to see that this is a start. Is it enough? No. Do we have a lot of work to do? Yes. And by the work that we see NCCS doing to insist that the cancer community receives coverage in some of the expansion of benefits, such as paid family leave, that is necessary. And that really has to get the support of the advocate community, meaning patients have to tell their stories. So look to these organizations like NCCS to partner and share that information about what your experience is. So raise the issues, right? Whether it's with your hospital or your elected official, or through a partner organization, tell them what our needs are, right? Is the need public transportation? Is the need equipment to do more telehealth or telecommute? We have a digital divide in America, and we haven't overcome that just because we were hit with the pandemic. So these types of issues are going to continue to come up. In regards to some of the legislation that's passed to help individuals impacted through COVID relief packages, we see the Families First Coronavirus Response Act, which adopted paid leave for people who are unable to work and unable to telework. There are 6 possible provisions which somebody can benefit from the paid leave. It's covered for up to 2 weeks. So for full-time employees, you can earn up to 80 hours of paid leave. Part-time employees are also eligible for paid leave. Full-time employees are eligible for paid leave for 100% of their pay, which is up to $511 a day. if they're subject to a stay-at-home order related to COVID, or if they were advised by their doctor to self-quarantine, if they're experiencing symptoms and they're seeking a medical diagnosis. Individuals can also receive 2/3 of their pay for caring for an individual or because school or daycare was closed for their children. And the paid leave is for all private employers with 500 employees or less and government employers. However, there's been a modification. Only one caretaker is eligible for the paid leave per family unit. And the paid leave under the Families First Coronavirus Response Act is for a period of April 1st to December 31st. So this is the first time that we've really seen a paid leave package at the federal level come into place. There is a small business exemption. There are other eligibility, right? The devil's in the details. So with all of these different laws that were recently passed, you're going to want to look at what those exemptions are from the employer perspective and the employee perspective. You can also use this paid leave with your FMLA. So what FMLA is generally is a federal law that allows individuals to take up to 12 weeks of job protected and benefit protected leave. For the cancer patient, that's almost everything. Again, having access to our doctor and having access to that treatment is a lifeline. A paycheck is essential. We need to keep a roof over our head. But at the end of the day, you said it perfectly. We shouldn't have to pick going to work or getting access to care. And so FMLA has been a really important piece for the cancer community. But what we see with paid leave now under the CARES Act is that you can use the paid leave to supplement your first 2 weeks of your FMLA. So while FMLA is job protected and benefit protected, it's unpaid leave. And that's a significant burden, and that many people cannot accept that burden. And so they continue to work even when they don't feel healthy enough to work. Paid leave allows you to take your FMLA leave and combine them if you want to get those 2 weeks of FMLA paid. We also have an expansion of paid FMLA, which is only for people who need to take FMLA under the CARES Act if they have children who are in school and that school has closed or their childcare has closed. And so what they can do is they can take their 12 weeks of leave, which is job protected and benefit protected. And weeks 1 and 2, they have to use the paid leave under the CARES Act. But then weeks 3 through 12, they'll get 2/3 of their pay. There are several exemptions associated with it and eligibility requirements, all specific to who is entitled to regular FMLA or emergency paid FMLA, and then the paid sick leave. So the devil's really in the details. And instead of trying to become a master in any one of these, utilize your resources, understand that things are changing quickly. But what we've seen through the 4 versions of the CARES Act and different legislative attempts at the federal level and at your state level is really significant steps towards trying to minimize some of the challenges being faced by families everywhere. But that's on the leave side. 22 million people filing for unemployment is profound number of people who are really trying to figure out how to make ends meet. What we've seen with Federal CARES Act, the additional $600 a week on top of your state maximum, up to 4 months. This is a significant additional benefit that will help people, especially in the cancer community, as we have additional, usually unanticipated costs that come up all of the time that are associated with our cost of care. There are the additional benefit to eliminate the waiting period. Part-time workers are eligible for benefits. And then under the CARES Act, the benefits have been extended by an additional 13 weeks of leave to whatever your state maximum was. So unemployment benefits, for instance, in California have been extended to a total of 39 weeks. And again, they're state specific. And then we've also expanded under the Federal CARES Act who is eligible for coverage. And so this now includes what we call gig workers, people who are independent contractors and freelancers can also file for unemployment benefits if they've seen a loss in employment or really a reduction in hours. or unable to get to work. The one category of people that you probably hear a lot from, and I hear a lot from, and this is the big void in the legislation as it relates to the cancer community, is what about those of us who don't feel comfortable going to work anymore? Or at least right now, we don't feel safe because we're living in a community that has a stay-at-home order in place. We are living in places where you're not allowed to leave your home without a face covering, but you are qualified as an essential worker, which may be that you work in a grocery store, you are part of the custodial staff at a hospital or police department or on public transportation. Bus drivers, subway employees, they're all essential workers. But if you are living with cancer and have a history of cancer, you're concerned that perhaps going to work is putting you in an undue risk category. Unemployment benefits currently have not been expanded to include people who are quitting their job because they're afraid of getting coronavirus. So that is also potentially an area for the advocacy community to work with in terms of helping folks who are living with cancer and making sure that they receive the support that similarly situated people in our communities are getting.
Thanks, Jamie. Wow, that was great. And a great outline of what kind of resources are available. And I love that you talked about how important it is right now to reach out, share your questions, share your concerns, share your story, even if you feel comfortable doing that. And I also want to put a plug for the NCCS resource page. It's at canceradvocacy.org/COVID resources. And we have a really great living page that's being updated daily. We've been working with the American Society of Clinical Oncology to answer questions about clinical care that we're getting from survivors every day. And so there are really fantastic resources posted on that webpage, and then also the information that Jamie talked about. And as always, NCCS is here to help, here to answer your questions. This is a pretty scary, obviously unprecedented time right now. No one wants to be battling cancer at any time in their lives, let alone during a pandemic. So I'm so grateful for the work that you do, Jamie, and for taking the time today to talk to me about some of the pressing policy issues during this time. As part of the resources, we've been hosting a series of webinars, and we've done a couple podcasts. We'll be doing more in the future. So follow us on social media to stay updated on those episodes. And I love it because at the end of each webinar or at the end of each podcast, our CEO has been saying that she wants to end on a positive note. So she'll ask, our expert speakers, like, what are you optimistic about? And I appreciate, Jamie, that you said up front that, cancer survivors are kind of better prepared for this than anybody else, with this insane curveball kind of dealing with the stress of their health and the healthcare system and navigating this crazy time. So Jamie, I'm going to follow suit with you and Shelley, our CEO, and I want to end on a positive note. And I'm just very grateful that my kids didn't come barreling through during the middle of this podcast recording. So thank you again for joining us today and for the incredible work that you're doing on behalf of cancer survivors everywhere.
Thanks for having me.
Thank you again for tuning in today to Cancer Convos. For more, click subscribe or go to canceradvocacy.org/subscribe. Take care and stay well.
In our next podcast, we'll talk to leading experts from the American Society for Radiation Oncology, Dr. Ronald D. Ennis and Dr. Lewis Potters, about the radiation oncology community's response to COVID-19 and what patients need to know about the impacts on care. Dr. Ennis is a radiation oncologist at the Cancer Institute of New Jersey, and Dr. Potters is chairman of radiation medicine at Northwell Health in New York. Thanks for listening to Cancer Convos. For more information about cancer advocacy, policy, and helpful resources for survivors, visit NCCS at canceradvocacy.org.